Hello friends, and sorry for the delay, and here are all the remaining questions of memory based NEET PG 2021. So starting with the first question, patient with history of chronic middle ear infection now present with neurological manifestations and headache along with vomiting. So also CT brain image was given in which abscess was shown in the temporal lobe. So answer is temporal lobe abscess. It can't be meningitis and not extradural abscess. Now, child with tonsillectomy lying in the ward started bleeding in the ward. What can be the next management? See, there are two confusing options: taking to the OT and pressure packing. But this is not. This is the primary thing. Take to the OT, remove clot, and religate. This is the better option if there is a condition like this. Now picture showing vial in which there is written like mitomycin C injection is given and which it is used for which of the following disease, and the options the answer is subglottic stenosis. Mitomycin C is used. Now patient of thyroidectomy which is extubated, but when you are removing after tube removal anesthesia one sees the patient is suddenly going into the cyanotic spells. So what can be the cause? For this, bilateral abductor palsy is the cause, and so it is due to bilateral right laryngeal nerve palsy. So this is the main issue. That is the answer also. Now microscopic image of a papilla of a tongue was given to identify that the answer is for that is circumvallate papillas. Now 16-month old child, 8 kg of weight, and on showing that assessing the growth chart falls between standard and -2 standard. So what is the management? So it is considered as severe malnutrition, and it is referred to the tertiary hospital or NRCs for better care. Now Anganwadi teacher is taking weight and height of 4-year-old and finding that height for age is -2 standard deviations. So likely causes in the likely causes this is the chronic malnutrition is the likely cause. Now child has recurrent yeast and respiratory infections, sinus infections since 3 months old. So this is the immune status can be assessed that it is immunocompromised almost. So which vaccine is contraindicated? So measles, MMR is the live vaccines. All the live vaccines are contraindicated, and TT, DPT and these can be given. Now 10-year-old school child under school health program which vaccine is given? So TTD is given because BCG is not given at it is given at birth. MMR is given at 9 months, and DPT booster is at 15 to 16 years. So TTD is the best option. Now outbreak of encephalitis outbreak in a community according to universal immune schedule, vaccine and route. So encephalitis vaccine is live and the route is subcutaneous vaccine is being given. Now low air velocity is measured by which of the which is very easy question. Carter thermometer is used for that. Now school PSC school health service is at which level? So it is at PSC level. Now air quality index is 407, so it indicates severe level of air pollution. These are one liners, very easy one liners to be honest. Now researcher with the CRP values, 4 CRP values, 1.5, 1.7, 1.8. So what does it indicate? It indicates that CRP increase disease risk or cancer risk. Now evaluation of functionality of a health center, assessing the clinical scan and clinical scanning or the outcome is the evaluation of functioning of a health care center, assessing the clinical working like PEP. Now the next question, pregnant woman niece is there and which contraindicated varicella vaccine was but negative for serum antibodies for varicella. So what does it mean? So she is susceptible for chicken pox. This means that she is susceptible for chicken pox. Now SI unit of brightness, illuminance. So illuminance SI unit is lux, and many of them are confused with this lux and candela. Candela is a SI unit for luminous intensity. Patient on MBMDT therapy, this is for Hansen's disease, and presented with inflammation over the lesions and nerve involvement is now. So what should be the treatment? So continue ALT treatment, and you have to start steroids according with them. Now 13-year-old male with the erythematous plaques over the face since 10 days and on MBMDT. See, this Hansen's disease, two questions and same on MBMDT therapy, and has been asked. This is an important topic. You should the next who are preparing for the next should give more focus on this. So yes, we came to the question again. 13-year-old male with erythematous plaques over face 10 years on MBMDT therapy for Hansen's disease. So why it is the erythematous plaques? So it is type 1 Leber reaction, and drug of choice for this is steroids. Now 18-year-old male to OPD with given that bleed, fever, and decrease in TLC count, and decreased platelet count, decreased reticulocyte count, and absent megakaryocytes are absent, and no immature cells. So what is the diagnosis for this? The diagnosis is aplastic anemia, and this is a picture of pancytopenia. So this is the answer is aplastic anemia. Patient to OPD with generalized weakness and lymphadenopathy, lymph node biopsy is given, which is diffuse effacement is present in that, and BCL2 is present and CD10 is present. So if BCL2 is present, this is follicular lymphoma. This is clue for that. Now software engineer, 10 to 12 hours work, sedentary lifestyle, HB is 9, MCV is 120, and most common anemia that can be that cause for this is vitamin B deficiency anemia. Now poor prognostic marker in multiple myeloma, it is beta 2 microglobulins are the poor prognostic markers in multiple myeloma. Now weak pulses in upper limbs and decreased BP and retinal hemorrhage. So which vasculitis is present? So Takayasu vasculitis, these are the features for Takayasu vasculitis. Now patient with the history of CML, like history is given like in the question, fatigue, anemia, and increased TLC count, myelocytes, and metamyelocytes. These are the things. So what is the best investigation? You will say FISH fish for BCR ABL. This is the best investigation for CML. Now pap smear with the hyperchromatic nuclei and irregular borders and low maturation index with involving the whole thickness. So what is the diagnosis? See, many of the things are given like hyperchromatic nuclei with irregular borders and low maturation index. So this is dysplasia and involving the whole thickness. So it is dysplasia. Now uterine didelphus will cause all of the following symptoms, like 3 of the symptoms are given, recurrent abortion, repeated abortion, transverse lie, and endometriosis. So it will not cause endometriosis. It can cause transverse lie and it can cause repeated abortion. Now management for uterine septum. So what is the management for uterine septum? That hysteroscopic resection of the septum. It is also called hysteroscopic septoplasty. This is the answer for that. Now infertile patient in a USG is showing uterine anomaly, and best to confirm this infertility, so hysteroscopy and laparoscopy is the best thing to confirm the uterine anomaly. Now 6 week of amenorrhea and left adnexal mass, beta HCG is 2500 and no fetal heart rate. So what is the management for that? Now, expectant management or self-injectomy or single dose of methotrexate. So single dose of methotrexate is the answer for this, because not we will be doing like medical management will be done in this kind of thing, and not expectant management and not surgical management. So this is not done, this is not done. Now, history of primary infertility with the two fibroids in cornua and associated with tubal block, and semen analysis is normal and ovulating women. So these are what will be the treatment for that. So ART will be the treatment and not myomectomy and not hysterectomy. Lady on OCPs for 5 months and with amenorrhea and since last 6 weeks. So best to calculate the gestational age, 280 days from the last menstrual period. So LMP, 280 days from the last menstrual period. Now, order of ligation of vascular arteries in PPH. So what is the order for ligation? This is also very easy. First uterine arteries and ovarian arteries, because uterine artery is very easy to ligate, and ovarian artery, and then internal iliac artery is ligated. Now, patient with post molar evacuation now has lesions in the lungs. The lesions are cannonball lesions. So best management will be emeco regimen. This is very important question. So with post molar evacuation and lesions in the lungs. Now, female patient, pregnant female with the active herpetic lesions in the vulva. So what will be the management? So management will be medical and acyclovir with elective C-section. Now, patient with infraumbilical flattening and fetal heart rate is heard on lateral side. See, infraumbilical flattening and fetal heart rate is heard on lateral side. What will be the presentation? So occipito posterior will be the presentation. This is very important. Now the next thing, husband asks for paternal testing, twins. One twin is the son, other is not the son. So what will be the diagnosis? Superfecundation will be the diagnosis, because at the two ovaries are released at the same time. So teen patient with the transverse vaginal septum, present with dysmenorrhea with chronic pelvic pain. So what will be the diagnosis? So this is a very peculiar dysmenorrhea with pelvic pain. Endometriosis will be the, and with along with the teen patient and transverse vaginal septum, endometriosis will be the diagnosis. Now, history of recurrent abortions at 8, 11th and 22 weeks, and cardiac activity present in all of the patients, and history of preeclampsia in the previous last pregnancy. That can be the diagnosis is syphilis. And CASA, which law is seen in this question. This is very important. New thing is asked, so keep in mind. Now, female missed OCP on 4 different days in the first 2 weeks of the menstrual cycle. See, on the 4 different days of missing the OCPs on first 2 weeks of the menstrual cycle. What will you advise? So continue taking the pills, or continue all 4 pills at once, or and continue taking the pills, and another method. No, the answer is continue taking the pills. Advise her to continue taking the pills and not to take all the 4 at once. Now, patient undergoing surgery is maintained on halothane, and severe hyperthermia with muscle rigidity is the cause. Which agent is the cause for this severe hyperthermia and muscle rigidity? So saxamethonium is the cause for this. Now, patient intubated for surgery. So best method to confirm patient ET tubes is capnography and not the chest rise or chest x-ray. Capnography is the best method to confirm the ET tube is in place or not. So I think I have covered almost all the questions, and if something is remaining, I will be posting it soon. So hope sorry for the delay, and hope you have a good score or rank. I will be assessing all the things, all the marks, and soon I will be making a video of that also, that what will be the expected cutoff and many of the things. So stay tuned, and good luck.